Of the day. I've been trying so long to get this guest on because he's a real doctor, and not that the other doctors are fake doctors, but meaning that he actually has a practice. And so sometimes it's a little bit more difficult for scheduling, but I just don't know why he's one of my very favorite people. He is the author of probably the most famous book in the plant-based world that so many people, when I interview, especially physicians, say is the book that really got them to understand this and want to go plant-based and teach that to their patients. I'm talking about The China Study, the book that the New York Times called the Grand Prix of all epidemiological studies. But he also has his own book, which you might like, which I really like, which is called The Campbell Plan, which is named after him. It's got recipes, it's got advice, and I want him to come on and tell you about what he's doing now. So please welcome Dr. Thomas Campbell. How you doing? Nice to see you.
I'm very good. It's a pleasure to be here.
Well, thank you. So you may not be seeing patients in person now, but what do you do at Rochester University?
So I'm the medical director of a weight management and lifestyle center. And at the center, we run groups and I see individuals basically to do a few things, to lose weight and also prevent and reverse lifestyle related conditions using food and exercise and, stress management, that type of thing. I also spend a minority of my time as a primary care doctor. So I'm a board certified family physician and I see people in a primary care clinic in a very typical kind of way. So I do both. I've been doing lifestyle medicine for a few years now, where I'm actually practicing with people and following them through the transition, through the trials and tribulations, all the difficult journey that this involves, So that, and I'm also doing research. We have a research program that's very exciting, although it's temporarily, unfortunately, on hold. But our research involves looking at diet and lifestyle on breast cancer, with breast cancer patients, diet and lifestyle with diabetes patients, and diet and lifestyle with kidney disease patients. So it's a full plate, and right now everything's a little upended, of course, but that's my routine.
Wow. So, what got you interested? I know I can understand why you're interested in lifestyle medicine, but why specifically weight loss and weight management? Because I'm guessing you didn't really struggle with weight yourself, or even come from a family of people that did.
Yeah, I mean, my family isn't immune. We're certainly not genetically the genetic protection, but you're right. It's I think my interest has always been in getting into medicine, this idea of holistic care, of using diet and lifestyle. And people say, it kind of drives me up the wall, using diet and lifestyle as prevention, to prevent disease. But actually the real sort of like wow moment is when you realize that diet and lifestyle can be effective treatment for some of these things. I mean, if I can get a diabetic to change their diet and lifestyle, I can have a better treatment outcome than all the pills and procedures I can give them, right? So my interest has always been getting lifestyle recognized as a important modality, important part of medical care. Now, in the medical system, the vast majority of people who say, hey, I want to change my diet, their goal really is, the number one goal is weight loss in modern America. So, the weight management and lifestyle center just happens to be kind of the catch-all for the number one interest, of potential patients. But I see people who have diabetes and they don't necessarily want to lose that much weight. They just want to reduce medications. I see people with cancer, with heart disease, and, you name it, people who have conditions that want to hear about diet as affected by that. But from a marketing kind of umbrella, I should also mention that we're actually part of a bariatric surgery center. So I work with weight loss surgeons, bariatric surgeons, in the same clinic. And then we have a non-surgical option. So that's kind of how it all came together.
Well, I would definitely like to explore that a little bit more with you. I didn't realize you worked with bariatric surgeons, but you had mentioned that weight loss is the number one goal in the world. Dr. Lyle has said that as well. Isn't that fascinating that people would rather lose weight than just about anything else, than be rich, than be famous? It truly is the number one personal goal.
Yeah, I don't know that I've seen any real hard data on that, but just from my own personal experience, most people who come with an open mind and say, hey, I want to overhaul my diet, the number one goal, I think, is weight loss.
Right. Well, we're with this COVID-19, people are calling it a pandemic. And I looked up the definition of pandemic and it said a disease that's prevalent throughout the country, throughout the world. Wouldn't you say that obesity is also a pandemic that's been going on for a pretty long time now?
Yeah, it sure is. And it's getting worse. And it's kind of interesting actually. And so I don't want to take this too far, but there's kind of this interesting research about social contagion theory. And if you look at some of that research, originally actually based on the Framingham Heart Study, they followed this cohort for many years, and they asked some social questions, and they asked, who are your friends and so forth. And what they found is that obesity spreads through social networks almost like a virus. And so don't take that the wrong way. Obviously, there's biologically, they're not suggesting obesity is a virus, but there's an aspect of this, our behaviors, our social activities, and our social norms that transfers, between people in groups. And so if you extrapolate that out, you see that struggles with weight have been increasing, higher prevalence of people have been struggling with weight, of course, and it's been spreading, and not only from in the U.S. but throughout the world. So it's really a worldwide pandemic at this point. Although it's not transmissible, obviously, like a virus, it is absolutely a pandemic, and it's not just struggles with weight. The reason we really care about that is because of the risk factors related to that weight. So, much higher risk of diabetes, higher risk of cardiovascular disease and its risk factors, higher risks of many types of cancer now we understand. And so arthritis, inflammation, pain, so all of these things are actually incredibly expensive. So yeah, it's a big deal. I also often told people, the pandemic, I think, has changed the commentary or conversation a little bit, but if you look at the data on obesity and the diabetes and how quickly that's expanding and how expensive diabetes is, that right there was looking like the main, a totally unsustainable sort of path. It's totally unsustainable trajectory for cost, for population prevalence. There's just no way, virus aside, there is no way that we were going to continue through those kinds of trends with obesity and diabetes. So, this virus is, rightly, of course, center stage, but we have very serious problems with our lifestyle health.
So we don't want to make anybody feel bad if they're currently overweight or obese. However, is it true what I'm reading in the New York Times that it is a comorbidity in general for all lifestyle diseases, but even in particular for COVID-19? I'm reading stories of especially the younger people that are afflicted. This is what I'm reading. Don't know if it's true. So I wanted to ask you as a physician if this is something people need to be worried about.
Yeah, unfortunately, and I'm not super familiar with all the data, but I do think from what I've seen, the sort of superficial reading I've looked into it, I don't know that it has a strong impact on whether you get the virus or not, but in some of the data, it seems like people who have a more severe reaction and more threatening reaction, obesity is a higher comorbidity that increases risk of that type of reaction. So, it's interesting. This virus, there's indications, of course, that it has effects on the blood vessel system. So it's respiratory virus, but it can affect the blood vessels as well. So you see a higher risk of clottings. And clots, and there's some vascular inflammation, blood vessel inflammation. And so, you can just sort of imagine people with high blood pressure and people struggling with extra weight, who oftentimes have a higher inflammatory burden. Add those together, and those are some of the main risk factors for, having complications from the virus.
Right. It's interesting what you talked about with the social contagion. I remember when I interviewed Dr. Dean Ornish for the Truth About Weight Loss Summit, he presented some data about how you're more likely to be overweight if your friend's friend is overweight than even if a direct relative was. And right now, many places like where I live, we're still sheltering at home going on 2 months. So ostensibly, this could be a good time for that to reverse because people aren't socializing. They aren't going to restaurants. How do you feel about that? Because some people are taking this time to do that. Other people are like, well, I'm so stressed, I'm just going to eat a lot of crap. And then when this is over, guess what? They're going to be the worse for it.
Yeah, it's interesting. There's that definitely that silver lining. This is kind of on par with the fact that the air quality is better. It's not necessarily a sustainable thing, and it's all quite the result of something very painful. But clearly, some of the people in our groups have mentioned, the social pressures, the social food environment is gone. It's been in that way easier, that they don't have to go to work and see the junk in the break room, and go have the work lunch, and go have dinner afterwards with a group of people who don't care about plant-based nutrition. So in some ways it's certainly made it easier, but my God, the way we got there is pretty miserable.
Yeah. Well, what, you're one of the people who said once at a conference that we both spoke at, that if you have temptation anywhere in your environment, you will fail. And when I say it, people get mad at me, but when a doctor says the environment is important, they seem to take notice.
Yeah. I in our groups I teach, I've gotten to be, I guess, a little bit caustic in that sense. I kind of feel like us as humans, we shouldn't really regard ourselves as that much more savvy than rats. I mean, we're all just kind of rats, all of us, and so if you have a rat cage and you change their food environment, you can create a binging rat, binging overweight rat. You can make all sorts of behaviors just by changing the environment. And I think humans are the same way. I think, how we end up where we are is largely determined by our environment. So if you want to change where you are, you better look at that environment. And that presents for a lot of people the number one challenge. They live in split households with a spouse that's not eating a healthy diet, or adolescents or college age kids who insist on junky food. Yep. So yeah, environment's king. Absolutely. For long-term health, for long-term sustainability, environment is king.
I love that. I got it on record. Thank you so much. We have so many nice comments thanking you for being here. Diane said, Dr. Tom, I was pleased to learn from you in the Cornell Plant-Based Nutrition course. So do you teach one of the modules in that course?
Yeah, I'm one of the course authors. So I helped put that together. That was a number of years ago now, and it's undergone a couple iterations. But yeah, I helped put together the previous iteration of the whole layout of that course, of the eCornell certificate program.
I took it so long ago, I don't remember you from it, or maybe I just wasn't aware of you back then.
Well, there was something when it first started back in like 2008. That was like version 1, and then around 2014, 15, we kind of took a big, huge leap to a new version, a new format with a bunch of different speakers and content and stuff. And it's undergone a couple little iterations since then as well. But
I'm sure that's when I did it then. I would have loved to have you as.
I did some presentations and stuff on that. So.
I would have loved to have you as my instructor.
Well, I don't actually interact with the students. I recorded some material for the certificate program.
Great. Well, would you like to jump into some of the questions? We see when you have a doctor, you said you wanted to do a Q&A. Now look what you got yourself into.
Yeah, sure.
So feel free to take as long or as short as you want to answer some of these questions. Sure. So this is from, when it's a name I can't say, I almost would rather just not say it than botch it. But Dr. Campbell, many experts are concerned children will not get necessary nutrients for brain development on a plant-based diet. What foods are important for parents to include to ensure optimal nutrition and brain function?
So with kids, I go back to the calorie density idea as a paramount idea. And as adults, and particularly most of the adults I see, most people could stand to lose a few pounds or more than a few pounds. And so we're talking about low calorie dense foods in terms of healthy plant-based nutrition. Oftentimes with kids, it's the opposite. I mean, these kids need to grow, and you get a 3-year-old that's got a room full of toys, and getting them to sit down for 10 minutes to eat is a challenge. So you can certainly focus on the high calorie density, healthy foods, the nuts, the seeds, the avocados, the nut butters, the grains, the baked goods. all of those healthy whole foods at the bottom of the calorie density of my iteration, that, the most calorie dense, healthy, whole plant foods are fantastic. And they like those things. Those things are tasty. They're nice. So I think for kids, go ahead and incorporate those as they're growing. And then as far as brain development, and, I haven't seen good evidence that there's any impairment from plant-based diets at all with brain development. I do think it's important, of course, B12 for all plant-based eaters should take a B12 supplement. And that goes for kids too. So, I actually have been recommending a multivitamin. I know in the plant-based community, there's a little bit back and forth about that, but I've been recommending a multivitamin, and I think for kids that's reasonable as well. So if you do multivitamin, you're eating, they're getting plenty of calories, their growth is good. There's no, particular concern for any one individual kid. That should be sufficient. That should be fine.
Thank you. And while those of you watching live, I really appreciate your questions. Remember, I've got to ask the ones that were sent in first. So please make sure you're on my mailing list, because we send out the day before who the guest is, and then you can just hit reply and then have your question answered that way. So Barb says, can you please have the doctor talk about people like me with insulin resistance fat rolls around the waist that aren't going away?
Yeah, insulin. Well, so a couple parts of that. I mean, insulin, I don't know that the fat rolls, for example, are any more particularly insulin resistant than any other part of the body. I mean, we refer to insulin resistance, that tends to be actually more than anything in the muscle. So the muscle is more than anything is where insulin resistance kind of resides. And the fat rolls, though, in particular, that just don't go away, that's a very common problem. And there's, I don't know any magic to that. Maybe you do, Chef AJ. I think, especially, I've seen some like 20-year-olds, when you're in your 20s and you lose a bunch of weight, things tighten up nicely. If you're, postmenopausal or in your 60s or 70s, I mean, my God, you can lose weight down to a healthy weight. You still got a roll there. And it's like, oh my God, this roll. And at that point I say, some thick skin. Well, if it's really traumatic, go talk to a plastic surgeon. So it's unfortunate that I have that message, but at some point, there's only so much you can do. You can't really target, particular part of the body.
Yeah, well, that's what Spanx are for.
Yeah, exactly right. Exactly.
After losing 60 pounds, I have a lot of loose skin and I don't want to have surgery. So if I'm wearing something that's, just wear Spanx, Yep.
Absolutely. Perfect. Yeah.
Absolutely. So this, again, doesn't say that person's name, but the question is it safe to consume silicone dioxide? This is an ingredient in many spice blends, including Benson's Table Tasty.
I think I don't know. I don't know. I'm going to pass on that question.
Okay. And I don't know either, but I do consume it, but I'm not consuming egregious amounts. Like I made a soup for dinner and has 1 tablespoon in it, and it's going to serve, it's going to be 8 servings. But yeah, maybe that.
What was the product that was in?
Well, I use a salt-free seasoning that I particularly like called Benson's Table Tasty, and I believe it's an anti-caking thing. That's my guess is the reason it's in there. What I can do is I can interview the owner of the company and get her thoughts on it, or maybe just, I don't know, we'll be talking to Dr. Goldhammer soon. Maybe he would know, but
yeah.
Yeah, absolutely.
I don't, as a general rule of thumb, there's a lot of people get really exercised or worried about particular contaminants in food or preservatives. And I'm no huge fan or proponent of chemicals in our food supply, but on the other hand, that's not where the real weight of health comes from. The real weight of health comes from the bulk of the food, which is the macronutrients, the fiber, the protein, the carbohydrates, the fat, and all the different components of that with the vitamins and all that. So the little bit of preservative or the thickener or whatever those types of chemicals are at the bottom of the list, I think that represents a far lower danger than the danger or benefit than the food itself. So it's a reasonable question. Is silica, is that healthy or not? And probably, if anybody gives you a real firm answer, I probably would say they probably don't know for sure. But I would say that, good question, but keep your eye on the target too, of course, which is paying attention to the whole foods.
Right. A lot of times people in the hyper health arena kind of sometimes major in the minor things, but you're so right. And a lot of people here, like Dina and Steven, say they have your book, and the book is the Campbell Plan. That's the one he wrote by himself. Then, of course, is the reason that you ended up going to medical school because you wrote the China study?
Yeah. So I had written the China study with my dad, and before I did that, I didn't really know what he did. I didn't know much about nutrition or health, but I spent 3.5 years reading nutrition articles and debating and discussing with him. It was like an old school medieval apprenticeship or something, in literature review. And so I got passionate about it. Was interested. And so I actually was at a conference with Essie, with Dr. Esselstyn, and we were sitting there together on a bench, and I remember sort of saying, I don't know exactly what to do with my life. I'm thinking, I like this topic. I could go get a PhD and do the more research side, or I could go to get an MD. And he sort of said, well, an MD will open some doors. And I kind of, this longer conversation, I kind of said, well, that's 28. It's a really long path. It's actually quite old to start. It's going to be really hard. And he kind of leaned into me, and he got this very upset look and this furrowed brow, and he kind of leaned in close to me, and he said, "So what?" So he was not impressed that it was going to be a hard path, and that's what I did.
Wow. Well, I mean, you're Tom Campbell, and you co-wrote the China study. Like, that's a big deal. You're so humble. Like, do you realize who you are?
Just some random guy. I mean,
but you're so humble about it. I mean, but seriously, Tom, I'm sorry I'm calling you Tom. I usually call
okay.
you Tom. But the thing is I interview a lot of doctors, and I always like to hear people's story. And that book gets pointed to more than just about any other, for the reasons, at least, that the medical doctors are doing this.
Yeah, but just like everyone else, doing this plant-based nutrition thing, I wrote that book, and then I kind of disappeared into the real world, and I'm still in the real world. And the real world, still thinks this is all kind of crazy. I mean, there's a lot of supporters, a lot of interest, and so forth, but I'm just sort of a crazy, crazy guy around the corner. It's not. So anyway.
Well, we love your humility. So this is a question from a different Tom, and another person actually has the same question. So Tom, the other Tom says, well, he says just such great things about you. You're such a joy. That is true. He says, can I ask you your thoughts about supplementing with EPA, DHA, algae-based? So many respected plant-based doctors are recommending it, but there's also some evidence about it increasing the likelihood of prostate cancer in men. I would like a very clear, sane, evidence-based response in the way that Tom can provide so naturally. And then the other person said EHA, DHA supplement in general for those who follow a whole food plant-based diet.
So great question. And I think there's a lot of uncertainty, and that's what this question is reflecting. And the problem is that some of the research on those types of specific supplements, all of the research is done at looking at those supplements and health outcomes in a standard population, mostly a Western population, so Americans. Now, Americans eating an American diet is very different than people following an Esselstyn diet, or people following the China study recommendations, if people following a strict whole food plant-based diet. That's a very different nutrient profile that's being consumed. So what we are faced with in the plant-based community is looking at research on Western populations eating Western diet and the effect of supplements on those people, and trying to extrapolate that to people eating a very different diet with a very different nutrient intake. And it's impossible. I mean, there's a lot of guesswork. So that's why you see some with, recommending this type of thing and others recommending that type of thing. And, generally my own take on it for certainly for adults, I do not recommend an EPA, DHA, algae-based supplement. I do recommend a healthy intake of omega-3s, so flaxseed or chia seed. And if you have very low added fat intake, if you're avoiding all the added oils, the vegetable oils and so forth, that omega-3 intake is very likely to be converted, I think, okay, to EPA and then to DHA. If you're consuming, this gets complicated, but if you're consuming a lot of added fats in a typical vegan diet, for example, if you add a little bit of flaxseed to your oatmeal, but you're consuming fat the rest of the day, you are consuming a lot of omega-6 fats. And that omega-3 fat cannot necessarily be efficiently converted to EPA and DHA because you're consuming all these other fats. So, in that particular case, with someone who's consuming a lot of omega-6 fats and a fair amount of added fat, I don't know for sure. It may be beneficial to take an EPA, DHA supplement, but if you're following a really healthy whole food diet with no added fats, no added pure fats, adding some chia seed or ground flaxseed is going to give you a good dose of omega-3 fats that can then be converted, hopefully with more efficiency, because it's a low-fat diet, with more efficiency to EPA and DHA. And I think that's, you look at, for example, the brain health internationally, historically, in dementia and so forth, which is a lot of people care about this. And, if you look at the Pacific Rim, Japan or China and in general, those countries ate historically very low-fat diets, and they certainly did not have an increase of dementia or brain problems or anything like that. And they were not taking EPA, DHA supplements. Now, they did have a little bit of animal food, but not that much. So, I think it's probably fine. I do recommend omega-3s in the form of healthy seeds.
Thank you. Because there's a question here from Anne that said, what is an acceptable amount, as in tablespoons, in type of preferred fats daily in a vegan diet for somebody that doesn't have cardiovascular disease or is overweight or is not overweight? I mean,
there's no exact science to this, disclaimer, but I say generally 1 to 2 tablespoons of ground flax or chia is appropriate every day. And then, the rest of your food is going to have some fat in it. So I keep it relatively simple.
Absolutely. Thank you. And Anne also asks, are calcium citrate tricalcium phosphate supplements recommended for someone with osteoporosis? I'm a 59-year-old female, 2 broken bones, foot, knee in the last 6 months.
Yeah, so that's another, nutrient of concern oftentimes is calcium. That's actually, I should have mentioned that for kids too. Kids should have a source of calcium. But calcium, if you look, there's one study, I think out of Germany, that looked at calcium intake and fracture rates. And they did find actually that vegans who also had a low calcium intake had a higher risk of fracture. So vegans who also had a low calcium intake. Now, if the vegans had I can't remember the exact, it was about 550 milligrams of calcium a day. If the vegans had at least that much or more, they had no increased risk of fracture. Now, this makes sense in the context of some of the balance studies, some of the calcium balance studies that looks to see how much calcium you excrete and how much calcium you take in and all that stuff. So I think, to make a long story short, I think it's reasonable to be sure for everybody to get, at least 600 milligrams of calcium a day. Now, if you're eating tons of leafy greens and plenty of beans, you can get that through whole foods. And if you're a little bit light on that, sometimes if you have some of the fortified plant milks, the soy, the almond, the cashew, fortified with calcium, likely you're going to also be above 600. And if you have osteoporosis and a history of fractures and you want to be sure, I think it's reasonable to take a supplement.
Great, thank you. Okay, I'm not sure if this question is for you or me because I'm doing a Q&A later, but I'm going to say it to you. It's about it's from Lori. It's about salads. Many people love chopped salads. Does chopping a salad negatively affect the fiber in our vegetables and fruits any more than normal chewing? I know it's less desirable to blend veggies in a blender, but what about just chopping them? So there's this tool called a mezzalune or an ulu, and basically you can take this much stuff and then you chop it down this much. And I like it because to me it's more palatable and also allows me to eat more salad easier.
How small are the pieces that you get out of that?
Well, I could run and have, do you want me to show you? Charles, Charles, Charles. I'll text him, but I'll show. They're quite small. I mean, because when you think about it at a restaurant, when you ask for a chopped salad, they'll charge you an additional $4 because it makes this huge bowl. There's a lot less chewing involved, and so for me, it takes less time, and I can get more in. But I'm going to actually show you because we always have a chopped salad while you ask them and see.
I think it's fine. That's my short answer. I think it's fine. I think where you really get the detriment is, like the question said, when you blend it, you really disrupt a huge majority of the cellular structure when you take a Vitamix and blend the thing up, 500 times. But just chopping into smaller pieces is fine.
Great. So, a lot of people worry about, like, again, these majoring and minor things. Could you please get me the chopped salad from the refrigerator? Because Dr. Campbell wanted to see the exact size. So people worry, like, obviously we're not recommending, fruit smoothies, at least not for people that are trying to lose weight rather than eat the whole food. But they worry, like, if they freeze the banana and put it through the machine to make banana ice cream, are they messing up? Is that like good or bad?
No, that's all fine. Minimal processing stuff is fine. So chopping, freezing, fine. I always harp on keep your eye on the ball. And I know I say that, keep your eye on the ball, making the right food choice. I know the people who are asking this question and following you are making the right food choice.
Thank you. So this is the size that it becomes. This is very little left. Is that too small?
Great. Looks good. No, very good.
All right. Thank you so much. And Anne says, how do you manage anxiety without benzos besides meditation and exercise? Are there any supplements? If you don't want to take that one, it's okay, because I'm going to be having Dr. Neil Nedley on, and that's kind of his specialty. But if you have any suggestions, because mine would be exercise, because I'm one of the most anxious people on the planet, and exercise is my medication.
Yeah, there's the medications, obviously, the SSRIs, probably even better than benzos, depending on the type of anxiety you have. But, that's the medical toolkit. And, some people actually find that they benefit from that significantly. And if it's at a point that may be indicated, I'm not definitely against those things. And as far as healthy lifestyle stuff, I mean, people with anxiety, I think one of the hardest things to do is to take that first step out of the anxiety bubble, if you will. So if you're, people who are anxious about agoraphobic or have social anxiety, it's very hard to get out into space. That's that first step is going to where you are sort of uncomfortable. But if people can cross over that path and get a little habit of without exacerbating things, going out and getting some exercise, going out and getting some sunshine. Sleep is crucial, absolutely crucial. It's getting good sleep. All hard to do with anxiety, but sleep, exercise, sunshine, all are important. And apart from that, a very good therapist and exploring why there's anxiety and so forth.
And well, one of the best therapists, in my opinion, is Dr. Doug Lisle, a frequent guest on this show, and he does do private consultations, $75 for 30 minutes. The person that asked this question, I don't know if she's watching live, but I would ask her why she is against exercise and meditation, especially because exercise is the most underutilized anti-anxiety agent there is.
Yeah, I mean, exercise, meditation, I think is very, very useful. There's certainly elements of our lives that are not touched by lifestyle, though. So lifestyle and lifestyle interventions have their limits, and it's important sometimes to recognize that and maybe step it up beyond that if you need to.
Oh, this is a very funny live comment. I'm not overweight, very new to all this. Can no longer eat meat, dairy, sugar, salt, processed oils, gluten. What is there left to eat? I'm starving. Oh my God, that's hilarious.
Well,
It's
you're in the right place here. You're
Yeah, it's actually called food, fruits, vegetables,
fruits,
whole
vegetables.
grains,
Okay.
legumes, nuts, seeds. That's hilarious. Okay, so back to the questions that were sent in. This is from Lisa. One of Dr. Greger's videos deals with the evidence that 2 cups of broccoli a day can decrease pulmonary inflammation. And of course, Dr. Esselstyn is famous for recommending dark leafy greens for dilated arteries and optimized oxygenation. In the age of COVID-19, these things seem especially beneficial. But then stories started coming out about the awful clotting docs are seeing in COVID patients. Do you think there's any reason to be concerned about these large quantities of vitamin K? Would you alter your own dietary intake of vitamin K rich foods, or do you think it's a non-issue? I have trouble believing that kale, broccoli, spinach could be bad for us, but I'm not a doctor or scientist.
Yeah, no, I wouldn't worry about the vitamin K issue with COVID-19 at all. I would continue to eat the healthy, vascular benefit foods, the foods of vascular benefit, and don't worry about the clotting thing at all. I mean, whether there's a personal history of clotting or some other rationale for people, if you got diagnosed with COVID, to be on an antiplatelet agent or anti-clotting factor or anti-clotting medication. I mean, that's a separate conversation. But the food itself, don't worry about that at all. It's really important to. I don't know how important it is for COVID-19. Nobody's studied that, but in general, it's really important to eat those healthy, blood vessel benefiters, the leafy greens and broccoli and so forth.
And we want to eat them in their whole food form, right? Because green smoothies. I mean, it's better to have a green smoothie than to have no greens. But isn't it better if we chew it and eat it rather?
Yes, much better, and particularly the smoothies. I used to have smoothies, Chef AJ. You might be surprised to know, when I was in medical school, and I had no time and I had no energy to cook, a side vegetable. I used to take a whole bunch of kale that was pre-washed and chopped, stick it in the Vitamix and add water. And that was my smoothie. And I used to have a kale smoothie because I wasn't getting greens. I'd go like a week and I'd be like, oh my God, I've had no greens. I better, do something. It tasted horrible. It's like, liquefied grass. But to make it tasty, and to make it enjoyable, people usually add fruit or a sweet vegetable, carrots or beets. And so as soon as you add the fruit or the sweet vegetable, you're adding a lot of sugar. Now you're getting into some territory where you're going to have a faster blood sugar spike and then a blood sugar fall. It's not going to be as filling as the solid food. And you get into a little bit bigger trouble. So yeah, I'm not a fan of the smoothies.
Yeah, especially liquid calories for people struggling to lose weight.
Yep.
Julie, who's watching live, says, I recently met Dr. Tom Campbell in Rochester. After his talk, I asked him to sign a copy of the China study, and I felt like I was meeting a movie star. He doesn't realize how special he is. He was so intelligent and yet down to earth and kind. The apple does not fall far from the tree. If you ever met his dad and mom, they're the same way. But he may not be a movie star, but he used to be a star of stage, maybe not screen. Do you ever want to get back to your acting roots? Because now that I'm 60, I don't want to say this is like boring for me, but I feel like I've said what I've said a million times. So now I'm getting back to what I really wanted to be when I was little, and I'm performing again and doing improv and stand-up comedy.
God, that would be amazing. I mean, the only thing stopping me is the responsibilities of adult life, little kids and job and work. But if I had more time to do that, that's my retirement plan.
Well, you're probably at least 20 years younger than me. I'm guessing maybe more, but I'm hoping when that happens, I'm still alive so that we can do a scene together.
Oh, that'd be awesome. Yeah.
So this question, I want you to answer as if this was an improv more than a doctor, because this is not a medical question, but because somebody's actually asking for a good comeback. So put your improvisational cap on, because Susan says, if time permits, and of course it does, you took the time to write, I need a good comeback for those who point out that they know in their circle of family and friends, as well as celebrities like Mel Brooks, who's 93, and Carl Reiner, who's 97, who constantly eat meat and dairy and appear to be leading great lives.
I would avoid the comeback entirely. Personally, I would have as well. This it's what Dr. Lyle says, which is, say this. I'll tell you what, this really seems to be working for me. There's a lot of people who are eating meat in their diet, and they are doing very well. I mean, there's no there's no argument against that. They're doing very well, and they may continue to do very well. They may be the French woman who lives to be 120 and smoking cigarettes all her life, and she finally had to quit smoking when she was 115 because she was too blind to light the cigarette.
Oh, that's
life is a fair amount of chance. So, what are you gonna do? They're doing well. Hey, I'm doing really well. Seems to be working.
Right. She stopped smoking for safety reasons more than for health reasons.
Yes. Yeah. Yeah.
But when people say to me, well, I had an aunt who lived to 105 and she did all this, people don't realize that even your parents' genetics are not your genetics, because you're a combination of both your parents. So
both parents, and probably there's effects of how they live, their lifestyles at the time that you were conceived. So there's really interesting, environmental influences on genetics, and your parents' genetics and your parents' lifestyle, when they were conceived, and so when the genes were passed down. So all of these things absolutely matter. And so the genetics is a big, people have a sense that they know their genetics, and sometimes it's not always so clear.
Right. Well, as long as we're talking about Carl Reiner and Mel Brooks, you probably don't have time, but what is Tom Campbell reading or watching on Netflix, if there is any time left over in a very busy day?
Yeah, so I've been watching HBO. I get HBO, so I watch, Westworld. I like really typical. I like on Amazon Prime, I've been watching Bosch. I have a very typical, sort of uninteresting entertainment. I like to sit down and zone out. I kind of like the guy movies and the guy action movies and that type of thing. It's not very intellectual. If you want to know intellectual, I've been reading the most intellectual book I read recently that I finished was a book by Chris Hedges, which is a very dark type of take on modern society.
See, and I would have pegged you for a comedy guy.
Yeah, well, I like comedy, but I like action. I mean, like I said, very, very typical. Give me a movie with The Rock and some sort of enormous natural crisis or military crisis, and I'll watch it.
That's good to know. Hopefully, your wife shares your same taste.
No, she definitely doesn't.
Well, if she ever wants to come on and talk about what she likes to watch, we would love to have her. So we've gotten through the questions that people have sent in. And so what I'm doing is I'm posting a link if you'd like to be on my mailing list. You get priority for your questions. And now we can take some from the live audience. And Sheila asks, what are the effects of alcohol on health in general, and particularly on heart health?
So historically, alcohol has been linked to improved heart health. So if you look at big observational studies, drinking alcohol was actually associated with a lower risk of mortality, because those people who had moderate alcohol consumption had a lower risk of cardiovascular disease disease outcomes. So that got this whole notion of moderate alcohol is good. That sense, I think, has been in question a little bit, and more recent years a little bit questioned. And furthermore, we've learned more about alcohol and cancer. And it's pretty striking to me that if you look at research, people who consume excess alcohol, so excess amounts of alcohol, that's linked to increased cancer risk of just about every place in the body that it touches. Oral cancer, esophageal cancer, pharyngeal cancer, potentially stomach, that's not quite sure. There's not much cancer of the small intestine, so that's skipped. But the large intestine, alcohol, increased risk of large intestine cancer, colorectal cancer. Alcohol is absorbed, metabolized. There's a possibility, obviously can be damaging to the liver in excess. And then we also know, for example, that alcohol of all these things is perhaps most strongly linked to breast cancer. There's research suggesting that there's no lower limit of alcohol consumption that's safe. So even half a drink a day has been associated with increased risk of breast cancer. And furthermore, we know some of the mechanisms for these things. We know this isn't just sort of a random association. We know actually how cancer is digested and absorbed and metabolized to provoke these cellular changes that can be pro-cancer. So I am, pretty against alcohol, and generally, even more other than heart disease and cancer, alcohol can cause heartburn and stomach upset. It can cause incredible sleep problems. It's associated with depression and, bladder issues. And so you go on the list and alcohol, and that's not even, mind you, I haven't even talked about alcohol use disorders, addiction, and, that type of thing. So I think people should limit their alcohol to 1 or 2 drinks a week. Now, that's my personal recommendation. If you look at much more moderate recommendations, they say women, you become sort of high risk if women consume more than a drink a day, and men consume more than 2 drinks a day on average, or if you binge at any one time. So that's a more moderate take. My take is limit it to 1 or 2 drinks a week.
Or preferably none if you don't drink already.
Yeah. Don't start if you do.
Right, exactly. Because the next question from a live viewer named Tammy is, how do you feel about black coffee? Because, I think sometimes people tend to look at things like based on their specialty. So for example, somebody who's not plant-based, it's a cardiologist, could say the reverse, whatever that word is, in wine is heart healthy. But yesterday I interviewed Dr. Will B, because he has a new book called Fiber Fuel. And he said for our microbiome, alcohol isn't good. And so lately people are saying, well, have 5 cups of coffee a day because it prevents strokes. But I can't imagine what it does to the gut. So what's your opinion on black coffee?
Yeah, so again, coffee, if you look at the associations, actually has some, associations that do suggest some benefit, very modest, reduced risk of certain things. I think there's a cancer association. Actually, it's very interesting, just to step back a little bit. I can't remember the population. I think it's a Scandinavian country. They found that something like 60% of all their antioxidant intake, because it came from one substance, which was coffee. The majority of all their antioxidants came from coffee, because coffee is bean juice and it has antioxidants and so forth. So the link between coffee and chronic disease, I think, is, there's no evidence in my mind that coffee is negatively associated with chronic disease. So I can't argue against that. What I will argue against, though, with coffee is people who have stomach problems and heartburn and reflux, people who have sleep problems and insomnia, and people who have bladder problems, incontinence. Now, a lot of postmenopausal women aren't going around talking about their incontinence problems, but it's pretty darn common. And so is stomach problems, and so is insomnia. I mean, if I had, every other patient has one of those things, at least, when I see them. So what are we really doing in this society? We're short shrifting our sleep and sleeping poorly. We're not really getting outside, getting sunshine, getting exercise, the vast majority of us. And furthermore, when we wake up, we're in a big rush and we skip a healthy meal. We don't have a good meal. So you have low sleep, no good exercise or healthy stimulation. You have no calories. So what do you have to do to function? You better go through the Starbucks drive-through, right? Or the Dunkin' Donuts drive-through, get the large coffee to function. And so we have this really unhealthy cycle of needing that stimulant because of the other unhealthy choices that we've made. And I encourage people to really get away from that. You got to focus on the healthy sleep, the stress management, and carve out time, change your schedule so that you can have at least a basic healthy breakfast, and get rid of the coffee, get rid of the addiction. Now, if you if you want to have, if it's a Saturday morning thing and your thing is to sit down with the paper and have a cup of coffee, black, just because you love the taste, you love the tradition, you love the pattern or whatever, then go for it. That's fine. If you're driving a long way and you're getting tired and you want some coffee, go for it. Drink some coffee. But this idea of being on the stimulant roller coaster every day is a really bad idea, I think. Now, like I said, I don't say that for its effect on chronic disease. I say that because of other lifestyle things and stomach and other, insomnia, that type of thing. So that's my take on coffee. When people join our group, though, given that's all kind of nuanced, and I can't really say that coffee is going to have an effect on chronic disease. When people join our groups, I say, get the food right first. Get the food right first. The coffee can be your second task if you want to take that on.
That's great. What about green tea and decaf coffee? They're asking.
Yeah, I think those are fine. Green tea is fine. Same thing. It's a little caffeinated. So if you get, some of the, depending on the brand and stuff, some of those teas are pretty darn caffeinated. So you just want to avoid getting in that unhealthy kind of stimulant rut.
Yeah, I think a lot of the questions come from what Dr. McDougall's been saying for years, is people really like to look for good news about their bad habits. Yes,
we sure do. And it's always, this is kind of an internal question I have, Chef AJ, and how do you celebrate? Because people have these moments of relaxation or celebration or comfort. They have little traditions, little patterns that they go back to, that's rewarding. It's sometimes similar to the first, as people who smoke, the first cigarette they have in the morning is a time to relax, enjoy. But when they give that up, there still has to be some way to have a celebration, to have a birthday enjoyment. So, that's a hard transition to have. And I think, and people feel like they can never have that again. And I think that's where you keep getting pushed back, like, well, what if I just have a little bit of my favorite thing? And that's that question comes up all the time. But it's a legitimate area to explore. Like, how are you going to have moments of celebration, to enjoy your new lifestyle?
Well, there are ways to celebrate without food and alcohol, actually.
Exactly. But that's a hard transition for people who have been, celebrating and relaxing with food their entire life.
Yeah. Well, how about exercise or even watching Bosch on Netflix like you do?
Yeah, that's zoning out.
Right. Exactly. So, I didn't realize, you mentioned at the beginning in your day job that you actually work with bariatric surgeons. I didn't know that was part of your practice. So is your job to convince them to go whole food plant-based and not have the operation?
No. So the way it's set up is that we're all sort of under the same department, but we don't necessarily see the same patients. People kind of decide, or they're referred to our program in a parallel pathway manner. So they're referred either for non-surgical and they get to me, or they're referred for surgical and they go through the surgery pathway. So I'm not actually at part of the surgery pathway, even though we're all kind of in the same department.
Yeah, terrific. Someone named Gotta Play It says, does coffee raise blood pressure?
So there's some research that it does acutely in the hours after consuming coffee. It can raise blood pressure. In the long run, I'm not sure that there's evidence that it does. If you look at the sort of steady state baseline, I'm not sure there's evidence. There's certainly not evidence that it increases risk of cardiovascular disease.
Nice.
Which is what we care about.
Gerald says, is there any research to suggest that isolated fiber, for example, fiber supplements or pulp left over from making plant milks is detrimental, similar to sugar, oil, or certain vitamins, etc.?
No, I'm not aware of any evidence to suggest isolated fiber is harmful. Generally, for the most part, that's not absorbed. So people, for example, with constipation who can't do it with natural foods, can't get away, you can't solve it with natural foods. If they want to take a fiber supplement, if that works, I'm totally fine with that.
So you guys, when you're asking questions, sometimes I don't know who they're for, if they're for me or Dr. Campbell, but I'm going to assume they're for Dr. Campbell because he's the guest. So the question is from, let's see, I'm sorry, Melody. What comfort foods do you eat? See, everything I eat is a comfort food now, really.
Yeah. So if I think about where I get into trouble and I overeat, and I do overeat sometimes, it's with the high calorie dense stuff. It's like the nuts, the nut butters. Occasionally, man, you throw in a little sugar, a little bit of maple syrup in there, and sort of a healthier, one of these healthier plant-based desserts, a little bit of maple syrup, a little bit of blended peanuts or something, forget it. I'm going to overeat the thing. Now, I'm not really struggling on increasing weight loss. So sometimes that's my cheat.
Do you have time? Do you have time in your busy day to exercise?
I do. Yeah. Yeah. In fact, I do. It's interesting. Well, it's interesting to me. I think it's interesting. I have a calendar up by the sink in the bathroom, and it's posted right there on the wall. And I have two types of stickers. I have stickers that are stars and stickers that are happy faces. And so I have a star for certain types of exercise, and I put it on my calendar. So so I give myself a little little sticker chart reward. I want the sticker, but yeah, I do exercise. I've been training. I'm currently training for a half marathon. That's going to be some sort of fictitious, non-existent half marathon. I don't know what I'm doing, running around, but
That's funny. And every guest, people want to know what you eat in a day.
so,
I bet I can guess. I'm going to guess breakfast is oatmeal and fruit. Everybody says that.
Yeah, oatmeal and fruit. And I do it in a really, really easy way. No pots involved. I just get a big old cereal bowl. I put the quick cook oats in there. I put a whole bunch of either frozen cherries or frozen blueberries, unsweetened soy milk, load it up, microwave the thing, eat it with some cinnamon. Lunch is usually leftovers. I might do, like I had some rice and beans today with a huge giant salad to start. And dinner, usually my wife Erin cooks something different every day. So it could be stir fries, it could be pasta, some type of pasta with a big huge side of veggies.
That's great.
And wow. Fruit, fruit is the snack. I don't really snack. I think thinking about this as I counsel people and thinking about my own life. I don't snack very much. I may have a piece of fruit, but that's pretty uncommon. Yeah, I have big meals.
Me too. They're so much more satisfying, aren't they?
Yes. Yeah.
Yeah, it's just more fun than to be eaten all day. I only eat twice a day, but it's just like, it's a trough, man.
Yeah.
I love it. Okay, Monica says, are antibiotics safe to use for a sinus infection or other infection? Till I took one, I didn't feel better.
If you need one, go ahead and use it. If, are they safe to use? I don't know. There are side effects to everything. So, we used to think the side effect was just the rare person who had an allergic reaction, but now we're learning more about the gut microbiome. There's certainly a possibility, I think, of more significant harm with antibiotics because you're killing off the bacteria in your gut. Now, if you have a raging sinus infection, I mean, my own kid, the last person you'd want to harm has had ear infections. And so he's gotten antibiotics, after a period of reluctance, sort of conservative care. He's gotten antibiotics. So if you need them, you need them. I mean, there's perhaps no class of medications that saved more lives than antibiotics. So.
Right. So Liz says, Tom, do you use mouthwash or not? I've never used mouthwash.
I don't. No. Maybe that's why everybody has been staying 6 feet away from me forever.
That's hilarious. Let me just type my answer here. Barbara, my doctor wants me to take Fosamax for osteoporosis. Is there another option you recommend? I always wonder when people have this, how many greens are they eating every day?
Yeah, there is actually good evidence from well-done research that Fosamax will reduce your risk of osteoporotic fracture. So it will reduce your risk of fragility fracture, meaning that reduce the risk of fracture from a non-traumatic event. You step off the curb and you break a vertebrae in your back. That's a fragility fracture. And there's good evidence that that class of medicine, the bisphosphonates, actually does reduce risk of fracture. And again, my passion is not in drugs, but hey, sometimes they work and they help. So you have to make that decision with your doctor about whether you want to reduce the risk. The number that's sticking in my head, it reduces the risk by about 50%, but it depends a little bit on what you're talking about, which bone site. So, certainly there's a benefit to that. There's also obviously some risks to medications. But the risks in that class, the people get very, very worried about the risks, things like atypical fractures, femur fractures, or throat problems. And generally those risks are really pretty rare. So there's a real benefit. The risks are pretty rare. Nonetheless, everybody's going to have a different take on that risk benefit analysis and what they're willing to do. So, and that's fine. Regarding lifestyle, making sure that you're getting vitamin D, getting outside, getting some safe exercise very regularly, and getting enough calcium, I think, are really important. Lots of leafy greens. Limit your salt intake. Limit your coffee intake. So coffee can make increased calcium excretion. Salt can increase calcium excretion. So those are my overall lifestyle recommendations: exercise, some vitamin D, calcium, leafy greens, and avoid salt, and animal protein, and coffee.
Nice. All right. So Monica says, is there, where'd it go? Is there a way, does Dr. Campbell have a website or a way to contact? I'll just give you a cell phone. No, just kidding.
So I'm not really available in my current institution to sort of take questions or consults from people from around the country. If anybody is in New York State with the new COVID thing, I suppose there's possibility. It's not totally set up, but there's possibility for like a telemedicine consult, through the healthcare system, if they're in New York State, and that's through the Highland Hospital Weight Management Center.
That's great. Okay, last question, because you mentioned it earlier when we were talking, because you talked about food addiction, and it just seems that there's so many people, including doctors in the plant-based world, that kind of poo-poo it. And, they sometimes criticize me because they say, well, I'm making it too hard for people to be vegan because of this, what they see as a very restrictive way to eat. But really what I eat is just food. I eat the same way as Dr. Ellen Goldhammer or Dr. Stefan Esser or Dr. Frank Sabatino or Dr. Joel Furman, and they're not food addicts, and yet they're eating the same way. So how do we articulate to people that this is a real thing? It's not everybody, but for those of us that are, we sort of have to tighten the screws a little bit.
Yeah, I don't know. The debate around that, I think, is somewhat academic. I mean, what actually, how do you define an addiction, for example? I mean, there's all sorts of academic criteria and back and forth we can have about addiction and whether food addiction is real or not real. But I can tell you just from working with people, all the hundreds and hundreds of people I've worked with over time and following them over time, it can be very useful, I think, to approach a dietary change as if there was an addiction. So using an addiction model. This isn't necessarily the perfect thing for everybody, but I think it can be very useful, because I find that when people open the door to little bits of their favorite thing, they open the door to having a little bit, it's just a little bit. 99% of the time, people are going to consume more than they realize. And furthermore, they are always going to be hostage to that craving. They are never going to get past that craving if they have the ice cream every Saturday night. It's never going to go away. So that's an addiction kind of model of saying, well, go to zero. And then like quitting smoking, go to 0 cigarettes so you can get rid of that craving. And that's the addiction model of of sort of treating, helping people change behavior. I find that to be very, very useful. So I am, I encourage people to be extraordinarily strict as they possibly can, in part because I think it's easier to be 100% than it is to be 90% or 95%. And the person walking in my office who says they're 95%, I guarantee you, they're probably only 60%.
Yeah. Well, I think it was
too many times, and it's nothing wrong with them. It's the human way. It's me too. I mean, we'll point the finger back at me. You have the same rationalizations, the same type of thing. So, whether it's a true addiction or not, I'm not an addiction scientist, but I can tell you it's awfully useful to think of it that way.
Right. Well, I agree with you 100%. It's definitely easier than 90. And, it's sort of like people back in the day, well, I'm vegetarian. I eat chicken and fish occasionally. Well, you're not vegetarian, and I'm strict 100% whole food, plant-based, SOS free, except when I'm eating candies, cakes, cookies, pies, and ice cream.
Yeah,
so,
right.
I think it was Dr. Walter Kempner who had a line, something like, all dieters are liars.
Yeah.
Something like that. Well, you're great. I mean, honestly, if you get bored, you can just text me and we'll put you up right away, because I miss talking to you. It took so long to finally get you in an in-person thing, and now there is no in-person things, but I know people really like you and your style. You're just you're very chill. You're not yelling at people. So it's very nice.
Well, it's been my pleasure. It's always great to talk to you.
Great. Well, I hope to get you on another summit soon, because people really, you need to be a bigger voice out there, because people love you. And if you haven't checked out his book, The Campbell Plan, definitely check it out. But of course, you've got to read the China study, because that's where it all started for so many of us. Thank you so much for your entire family's legacy and for the work that you're doing now. And I look forward to the day that we can finally perform improvisational comedy.
Yeah. Thanks, Chef AJ. We'll talk soon.
Great. Thank you, Tom. And thank you all for being here. And if you come back at 2 p.m., we're going to have a live Q&A with the guest known as me. I do it once a month. Take care, everybody. Bye, Tom.
Bye.